Good morning, everyone. Welcome to another episode of Voices for Tibet. I'm your host, Karma Tensam. I'm with the Tibetan Children's Education Foundation. In our continued efforts to share Tibetan culture, today we are going to be talking about a fascinating subject called Sorig. Sorig is the acronym or the shortened form of the word Sowa Rigpa, the Tibetan traditional system of healing. And to talk with us today, I have a fascinating guest. Her name is Dr. Tawni Tidwell. She's the first Westerner to become a Sorig doctor. Isn't that fascinating? I'm so privileged to be talking to Dr. Tawni Tidwell today. Dr. Tawni is actually a biocultural anthropologist and a Tibetan medical doctor. As I said, she's the first Western person to ever train, study, and become a Tibetan Sorig doctor. She studied at Mentse Khan, which is in Dharamsala, northern India, as well as at the Sorig Lolling Tibetan Medical College in Qinghai, that is in eastern Tibet. She completed the comprehensive 5-year medical college. She followed it with the 1-year internship and subsequent apprenticeship with many master Tibetan physicians across the Tibetan plateau. Dr. Tawni, I'm so jealous. I haven't been to Tibet in a long time, and you had the privilege, but I'm going to continue with your bio. Dr. Tidwell's doctoral research combined research from contemporary neuroscience, Buddhist epistemology, and biocultural and anthropology to understand how Tibetans learn to embody diagnostic practices, particularly for cancer and metabolic disorders. Previously, she was at the Austrian Academy of Sciences. Now she's at the Healthy Mind at Madison, Wisconsin. Dr. Tidwell extends her work investigating how Tibetan medicine understands physiologic, psychologic, and contemplative paradigms of transformation, healing, and resilience through studies on COVID-19, chronic inflammatory conditions, and neurodegeneration. Thank you so much, Dr. Tidwell, for being with us today. So I'm going to be jumping into Sorig, but even before that, there's something that I'm really curious about, and I suspect some of my audience will be equally curious. How did you undertake this journey towards Tibetan medicine? How did you become a Sorig doctor? That for me is fascinating.
Thank you again, Kartan Samla. It's a pleasure to be here and a pleasure to be with your community. I've read a lot about your work, and it's just incredible to see all the lives that this organization has been touching. So thank you so much for having me here. And I'm so grateful also for all who are participating and being voices for Tibet. I think this time more than any, Tibetan culture, the deep history needs to be more present in people's mind. And I think now that we are in this difficult time of the pandemic, people are really struggling and seeing the resources that this incredible cultural treasure can bring into their lives. So thank you so much for all your work and all those of your community here. So I honestly came to Sorig kind of in the back door. I grew up in South Korea when I was really young, and my dad was an army doctor and an orthopedic surgeon. And so I saw in Korea different medical systems, and we came back to the US, and I thought I thought I was interested in medicine, but I wanted to study a different Asian system. I thought Chinese medicine, but really my main interest, I wanted to be an astronaut. I wanted to go to space, and I wanted to understand the body in extreme conditions. And so when I was at Stanford during my undergrad, I started, I was pre-med, and I was looking at all these different programs, and there was a program about Dharamsala, and it talked about Tibetan medicine. And I had met His Holiness in Colorado when he came for a massive peace event. And so I'd already been following all of his teachings, but there in that time, they talked about, Tibet is on the rooftop of the world. You have amazing yogis doing incredible things with their bodies and minds. And I thought, this medical system has got to have a different way of understanding the body and the mind. And I was very curious. And so at that time, Emory University had started a program with His Holiness's Institute of Buddhist Dialectics in Dharamsala and the Sara College of Higher Tibetan Studies. And it was the first time they brought students over to learn Buddhism and Tibetan language and everything. And so as a freshman, I contacted the director and said, can I join? And she said, no, you're too young. And somehow I convinced her that I could do it. And she let me come over, and that's when the world kind of opened, and I was able to go to Mensikang and just learn a little bit about what Tibetan medicine is. And I realized at that time, if I really wanted to learn about Tibetan medicine, the language is first.
That's right. That's right. So I was about to ask you that. How did you enroll? You have to first learn the Tibetan language.
Yeah. So while I was at Stanford, there was a Tibetan in the medical school working in the medical records department, and his father was an Amti, and his name is Sonam Lama. And so at Stanford, if you can find 2 other students who are interested in a rare language, they will help you, support you to learn the language. So I found 2 other grad students, and they brought Sonam Lama over, and we started learning with him, and it was amazing. He told me, Tibetan language is one of the easiest languages in the world.
That's not true.
I know, but very skillful of him. Yeah. So I thought, oh, okay, now I know. However many years later, it's one of the most difficult, but from that time. And so I went to Tibet University after that, and then just kept growing and learning, and just tried every opportunity to speak with Tibetan friends in the Bay Area and continue learning with Sonam Lama. And after 12 years, it was 12 years by the time I could think about maybe sitting for the exam at Mensikang. My friend said, Tawni, you've just had your toe in the water. I'm going to push you head first in. And so to train for the entrance exam, he every week would have me write essays and memorize the Danjuk and give me all sorts of questions. And I realized at that time I had only barely known anything. And that year he put me through Tibetan language boot camp. And then I sat for the exam and I barely passed. It was only...
But you did pass. See,
I did pass. So yeah.
That's so fascinating, Dr. Tidwell. It almost sounds as if this was even like a karmic journey, something that as a Tibetan, we talk about weird things like karma and stuff like that. So in my mind, it almost sounds like you were meant to be a Sorig doctor. The circumstances all led you to being at Mensikang. But now I'm going to go back to Sorig, and I wanted to tell you, Doctor, that many of our listeners might actually be new to Sorig. They might not have heard about the Tibetan system of healing, and this might be something really fascinating, but at the same time new. So I wanted to begin with this fundamental question. So what exactly is Sorig, and what are some of the underlying fundamental principles behind this system of healing?
Thank you again, Karma. So Sorig is really, I think, one of the most remarkable systems of the scholastic Asian medical traditions, because it really draws from history that fed into what became Ayurveda, what became Chinese medicine, and what became some of our great medical traditions all over East Asia, but also Central Asia. So in Nalanda, when a lot of these monastic universities were developing, you had a lot of the physicians who were treating in the Vedic period, right? Through all the different caste systems, they had to go through purification rites. It was this kind of a rebellion in many ways to say, we want to start learning and be able to not go through a lot of these purification rites. So you had them go to a lot of the Shramana communities in East India, right? And working with a lot of the yogic practitioners. And that body knowledge became what then fed into the great treatises that then fed into Ayurveda, that came through Kashmir into Tibet. And then you had the Silk Route, you had all this knowledge coming from Persia and Greece and China, and that synthesized with ancient Gulge kingdom and the Shangshung native medical tradition to birth then Tibetan medicine.
That is so fascinating.
When Buddhism came in, this massive project to translate these texts and to bring in this wealth of knowledge, right? And that fed into understanding also, how does the mind affect the body? how does it animate our physiology? How do our behaviors that are driven by our desires or our frustrations or our aversions then factor into illnesses, and throughout our life course really impact our whole lifetime of health and wellness experiences, as well as the challenges of illness. So this is how Tibetan medicine really initiated and has now for many, many, many centuries. And in a way that I think is unique also is that for the focus of transmission to really canonize the knowledge through highly systematized translations has been unique in Tibetan medicine, because if you see in Ayurveda and Chinese medicine, they haven't had the same systemization and canonization of these texts that has allowed it to propagate through history with a robustness and integrity. And with that also is that we then use in Tibetan medicine, materia medica, medicinal substances from all of these regions. So we have the biggest pharmacopoeia of all the Asian medical traditions, and that has also fed into how we make different formulas, that sometimes we have up to 140 different minerals and substances and medicinal plants in one single formula, which you obviously know, but I think for our listeners to know that it's one of the most diverse traditions that's also been canonized to bring together the richness of medicine and medical knowledge throughout the history and throughout that region.
Right. And I'm going to be speaking about Tibetan medicine also shortly, but it sounds like, as if just listening to you, it's a really holistic approach to healing. I once talked to Dr. Kelsang Wangye in California, and he talked about the three humors or the different energies that form the basis of this healing system. Can you talk a little bit about that?
Absolutely. So we call them the Nyeba, the Lung, Ti, Began, Sum. So Lung, Tipa, and Began are these three systems. And so Nyeba literally meaning the faults or the Achilles heels, if you will, what will bring on illness. But they're also systems, right? So they're animated by attachments and aversions and delusions that then persist in the body. So you can think about it on a functional level, that we have an inclination to procreate, to have relationships, right? But on the dysfunctional level, that we get obsessed and attached, and these form addictions and fixations that then lead to different illness trajectories in our body. So Tibetan medicine uses these systems to, in many ways, delineate different body systems. So in Western medicine, we have the nervous system, the reproductive system, right? We have the neuroendocrine system, musculoskeletal system, circulatory system. So in a similar way, Lung, Tipa, and Began draw these systems together. So Tipa has more metabolic functions, right? Began has more about the joints and the fluids. Lung is really more about the nervous system and how the mind works. So we understand the body through these different systems.
So what would be the English translations of Lung, Tipa, Began? What sort of English words would you use for them?
So many have decided to translate them as winds, phlegm, and bile. Right. However, I think that might be misleading to our listeners and to the general public. And I've been trying to encourage us to keep the terms Lung, Tipa, and Began, because the Greek system used those terms, and they really mean more humors and fluids in the body. Right. And these systems are actually energetic pathways of signaling and linking organs and tissues and cells. And so I think it's a much more complicated way to think about how these systems work.
Okay, I got you. Okay, then we have that system, that basic background. But then, doctor, as a Sorig or Tibetan medicine doctor, how do you diagnose a patient and how do you treat them? So I guess treatment starts with diagnosis. So let's start with that. How does a Sorig doctor diagnose an illness in a patient?
Great, thank you. So I like to describe it as that the Amti, or the Tibetan doctor, is the embodied diagnostic instrument themselves. So they are using their perception to look at the tongue to look at the urine and to look at the pulse. So taking the radial artery pulse on both wrists and looking at how that relates to different organ systems, the blood quality, the chuser, we call the chuser, which is the interstitial fluid combined with the serum and cerebral spinal fluid. So how all these fluids change and metabolize in the body. So through the perception, so one famous, right, Amchi one of our great has passed. He was known for coming in, and before meeting the patient, he would look at the urine, diagnose it, and then he might have 10 different urines, and he'll bring it back to the patients and give them their own urine. He's never met them, right? And so it's this accumulation of embodied knowledge, which I think from, if you talk with most Western physicians, actually, they use a very similar method, but they might not admit it. So many cardiac surgeons will say, that I've spoken to, that will say that a patient comes into the office and they know just how they're walking, their movement, they know what's going on with them. But of course, they're going to do the diagnostics and the imaging to make sure how they're going to actually treat them. But they probably know what approach they're going to take from the start. And so in a similar way, it's experience, right? It's perception, it's an embodied sort of
But I have to say, Dr. Tidwell, that the pulse diagnosis absolutely fascinates me. Of course, as a Tibetan, I've consulted Tibetan doctors. I've been there, and they will just feel my pulse, listen really intently. There's a moment of deep concentration, and then sometimes even before I have told them of my problems, they will tell me, are you suffering from, or do you have a problem sleeping, or is your digestion a little bit sluggish? They will tell me these sort of things before even I've told them what the problem is. How are Sorig doctors able to do that, doctor?
Yeah, this is such a good question, Gunnar. I actually have no idea from the Western science perspective how to explain this.
Right.
I first, so for my doctoral research, was wanting to be able to say, how do physicians train in this? How is this expertise cultivated? And one of my advisors, who's a MD, his name, so he is Mel Connor. He's a very well-known doctor who helped to establish the research that led to the paleo diet. Now everyone knows about the paleo diet, right? He with the Kung San in Botswana. And so he said to me, Tawni, I don't believe this, that a Tibetan physician can get anything from the pulse except for your heartbeat. And I said, okay, well, how about I just see what the text says and I'll take it for a test drive. So in my research, I just said, I don't know how this works, but I'll just see how it works. And I have to tell you, it was a remarkable experience to see how just suspending belief and saying, okay, let's see what you can take from a pulse, and looking at each organ system underneath the index, the middle, and the ring finger, right, on both hands, how much you can tell. And because my focus was cancer, by the end of my time when I was in Zhongwen in Amdo in Eastern Tibet, we would have 100 patients in the hospital every morning, 100 pulses every morning. And I started to be able to feel what that pulse felt like, that beating pulse under specific organ that said cancer, right? That said a gallbladder that needs to perhaps be removed, right? That is dysfunctional, that has a lot of lethargy and inertia in its ability to actually function. And so what does that feel like on pulse? I don't know how to explain how it works, but what I can tell you is that it works. And it's to this day, it also is amazing to me even.
Yes, at least among us Tibetans, we have been fascinated by doctors who can actually diagnose many ailments just from feeling someone's pulse. So that's fascinating. And then, doctor, I wanted to continue this conversation and then come to Tibetan medicine. I know you alluded to it just a little bit in your introduction, but tell me more about Tibetan medicines. How do they make their medicines, and what are some of the main components of Tibetan medicine? That's again fascinating.
Thank you. So it's also one of my greatest joys is our mentor, our medicine compounding. It's I feel like Tibetan medicine has been able to preserve this ancient form of understanding and recognizing in our natural world the elements, right? And elements meaning the principles of energy. So I like to think of the Chunganga, the 5 elements, as like a Tibetan form of the periodic table of elements, right? How to classify the properties of material and energy matter in our natural environment. And those combine to create tastes. Those combine to form different potencies and post-digestive tastes. And so I like to say that amchis have a laboratory on the tongue that they can test and assess what is the chemical profiles of these different substances, and based on those combine them. And so in Tibetan medicine, we always talk about it's important for the nuba, the different potencies of the different substances and the elements, the taste, to combine in such a way that they're easy to digest, that the activity, the penut, the benefits arise more in different ways, sometimes faster, sometimes slower, depending on the condition. And through that process, combining these to create a substance that is really minimal in its side effects and maximal in the kind of functional benefit that we would like to see from it. So one of the most incredible examples, I think, is sotel. So this is a compound, right, used in precious pills. And sotel is a mercury sulfide base that has organometallic, so different organics, herbal, and various minerals that are ornamented on it. And at Emory, we've been able to do some research on sotel that actually many of our chemistry colleagues are just amazed, because it is a nanoparticle that has within the therapeutic index that's very rare for this kind of particle, that is different than, say, cinnabar, which is also a natural form of mercury sulfide. But somehow through history, Tibetan physicians figured out how to make this incredible medicinal substance that is blowing the minds of chemists today, in today's chemistry world, that's right within the therapeutic index and also shows no mercury toxicity. Dr. Sarah Solin at Hadassah Medical Center in Israel, she worked with Mensikang and has published work on it, and showed that actually cognitive abilities increase taking precious pills. And that the only mercury that she could find was leaching out of the urine. There was no mercury toxicity symptoms. That actually they had various functional benefits coming through blood, through a lot of the lymph and immune system functionality. Right now, there's a lot of work coming out of Tibet showing similarly. And so this is something that we've been working with to look at, how do these substances form? Well, we use these substances for cancer, for different metabolic disorders, for blood disorders, for various organ conditions, neurodegenerations. And so it's this, in many ways, I would say, an ancient alchemy, so to speak, that is remarkable, really remarkable.
See, I was so interested to hear that, because especially as it pertains to the precious pills, there's been some skepticism that, the mercury content or something might be a little bit harmful. I'm so glad that you put forward that perspective. And as a Tibetan and proponent of Tibetan culture and medicine, I'm always happy to hear positive things about our culture. But sometimes the Tibetan system of medicine, people often commonly refer to that as also a herbal system of medicine, indicating that a lot of herbs are used in the making of medicines. Doctor, can you tell me some of the more commonly used herbs in Tibetan medicine?
Thank you. Yes. So most of the herbs are endemic to the Himalayas. So in many, what we might not recognize in especially in North America and Europe, are the most common herbs and various substances that we use for. So for one that would be more commonly known would be similar in Ayurveda, which is you also use in Triphala. So you have the Arura, Baruda, and Gurura. So these are the myroballic and tribulic forms of myrobalan, right? And then this is also the Indian gooseberry. And so these combine to form a really important base medicine for us for blood purification, for separating out poor quality blood from healthy blood. And this also helps with digestion, with kidney function as well. So this would be one that's more sourced in India. And then we have a lot of our aconite species. So a lot of the aconite species considered poisonous in many times different species of the aconite family. But we find ways in Tibetan medicine to detoxify these herbs and to use them for their medicinal benefit. So we use different Meconopsis species as well. Swertia is another plant. So these are also very, very bitter plants often that then help to tonify the liver, to help stoke and increase digestive fire, and also to help cleanse the blood through these processes as well. So Herbert Schwabel, who is the CEO of Padma, the company in Switzerland, who is the first company to produce Tibetan medicine formulas under regulations in the European Union.
Right.
Yeah, he has talked very beautifully about the research that they've done on how to understand Tibetan medicine. We really have to understand it through a network pharmacology perspective or systems biology. Understand that a lot of Western medicine focuses on a very pure substance that focuses on one receptor in the body. But Tibetan medicine looks at many, many different receptors and works on to modulate it in the body. So a lot of times the functions are really about how the body responds immune-wise to stress physiology, to how the actual organs function. And so we have to understand it from a different perspective, which we know from HIV research that actually when you combine different cocktail formulas, right, you get better functionality, you get a synergy of effect, and you actually get less toxicity in the body. So even in Western medicine, they're starting to understand, oh, this is a very good approach, which Tibetan medicine has used for however many, hundreds and hundreds and hundreds of years. So
that is fascinating. That's fascinating. And then, Doctor, I wanted to touch on this topic of Tibetan medicine and COVID. I read in your bio that, you did some studies correlating Tibetan medicines with COVID. Is there really sort of any Sorig or Tibetan medicine treatment or approach towards treating the COVID?
Absolutely. Thank you for asking about this. So in the US, in Canada, we had a really wonderful opportunity to support many, many in the Tibetan community and also beyond, when especially a lot of the mild and medium severity cases arose. Especially New York City was a hot spot, Toronto was a hot spot. And I think in Tibet, which we might be also seeing in India and Nepal these days, but in Tibet particularly, when COVID first came to especially Qinghai and Tongwen, any COVID case was put in to the hospital and had to have Western medicine as well as Tibetan medicine. We weren't able to see a lot of the effects. So Daozong was one of the hot spots, right, near Ganze in this area, right? And so they had less than 100 cases, but still some really good results. But we couldn't say, is it Tibetan medicine that's benefiting it? And Lhasa and Xining and Oliver Com as well, they put out protocols of what they would do just on Tibetan medicine, but they didn't have the opportunity to actually support patients in this way. And you see this all out over Asia. You had a lot of COVID patients getting, heavy amounts of antibiotics and steroids and all sorts of things, right? And so for us, because a lot of mild and medium severity cases in North America, people were home. Many of our Tibetan community are nurses or healthcare workers, and they would be treating it in COVID ICUs, right? And coming home and they would get sick and they would turn to Tibetan medicine first. And so we were able to track these cases. And so for us, we didn't have a protocol that was identical across all patients, because in Tibetan medicine, it's about the individual person, right? It's their constitution.
Sure, I understand that.
The dietary and lifestyle recommendations. And so there were different formulas, a lot of our Tang formulas like Tu Tang, Nobadun Tang, Manoshi Tang, Sulashi Tang, that were used initially to increase the fever and then break the fever, and then to help recover the organs. So we had a lot of different kinds of formulas, Bangzi Chuni, Bangmin Chonga, Jukanyanga, that were used thereafter. But what's been really exciting is that we now have over 200 cases that we've been able to track, and to see that actually for a normal course of mild and medium severity case, it's about 2 weeks to recovery. And a lot of our patients are recovering in 8 to 10 days. And
Wow.
what's unique is
Wow.
also we didn't see the long hauler effects. We haven't seen these persistent inflammatory conditions that we're seeing now across the population after having COVID, right? Heart conditions, kidney issues, various neurological symptoms that kind of persist over time, cognitive issues. And we're not seeing that with our patients after they've gone through their Tibetan medicine course. And we're seeing now also long hauler patients coming who haven't taken Tibetan medicine yet, who are looking to treat these issues as well. So I think it's become a time where we're really fortunate to be able to have Tibetan medicine in North America, to be able to offer this and to support patients during this very, very hard time.
That's remarkable. This, what you said just now, that knowledge is truly fascinating. And then, Doctor, I'm perhaps coming to the end of my segment, but among us as Tibetans, as Tibetans, when we talk about Tibetan medicine, and this might bring a smile to your face, it's among ourselves, we would say, well, Tibetan medicine is not so good for that, but it's excellent for this. Like one example we give ourselves is, if you have like a chronic case, and that is something that Western medicine cannot help, you should try a Tibetan medicine. It's really good. But based on your studies, based on your investigations, what are some of those diseases, or what are some of those conditions that you would say Tibetan medicine works really well?
Thank you so much for this question. I also think that one of the things that I've noticed is that because the materia medica that we use for our Tibetan medicine, often we gather it in Mari and a lot of the areas up near kind of Kulu and Kaza in Himachal Pradesh. My curiosity is, I wonder if the potency of the actual medicinal plants is less. Because what I've noticed is that in Tibet, a lot of our even acute conditions can recover really well with Tibetan medicine. From what I've also experienced in India too, where we say, no, just the chronic illnesses, don't worry. Right? But with COVID, I'm like, wow, we've seen amazing effects. So this is a question in my mind. But I would say in general, Tibetan medicine is excellent for gastrointestinal illnesses, liver conditions, neurological and neurodegenerative conditions. Very much in terms of blood quality, so various hematologic conditions as well. And so these are been so our leukemias, our lymphomas, as well as just different blood disorders. And so this is something that I've seen consistent. I've also seen for women's health. Fertility has been remarkable. Amshi Lobsang Tunduk is responsible for many babies, several hundred, and he's been in for several decades. And so I think the possibilities of Tibetan medicine we're just starting to really understand. But I think, and then cancer. I mean, Amshi Yeshe for a long time. One of my main teachers, Amshi Kenneth Gyamso, who's in Toronto, who's been very well known for his treatment of COVID. He himself alone has 250 cases he's treated of COVID. So I think there's many conditions, but I would say these are the main ones that it really excels at. And I think part of this is also what's exciting is that in Western medicine, we've started to get really excited about the microbiome, right? And the relationship between the gut and the brain. But this is something in Tibet medicine is known for a long time, right? Is the relationship between our mind and body. And so I think this is also where it excels, is understanding how our emotions, and also through the medicine, how to work with these systems that are interrelated and not just isolated organs sitting in a body. So, yeah.
Right, Doctor. And so thank you so much, Doctor, for being with us. Actually, I wanted to put it this way. I've lived in India for 40 years, and we have the wonder. What Tibetans have started to do in exile is we have started to recreate many of the institutions that we left behind in Tibet. And as Doctor will vouch, one of the most amazing institutions we created in exile is Menseka. the Tibetan Medical and Astro Institute in Dharamsala. Through mainly that effort, I know that in India, there are literally scores of Tibetan medical clinics throughout the length and breadth of the country. And I know that aside from the Tibetan community, Tibetan medical system, the Sorig systems, has literally touched hundreds and thousands of lives. And then as a Tibetan activist, on the Voices for Tibet, I celebrate all that is good and wonderful about the Tibetan culture. In the past, I've always been very enthusiastic about the Tibetan spiritual heritage. I've always believed it's second to none. I believe that it has the potential to touch millions of lives. And so, Dr. Tidwell, today, as a Voices for Tibet, and throughout the interview, you were wonderful in your plug for Tibet. But as this voice for Tibet, as this voice for Sorig, as this voice for the Tibetan healing system, can you give me your last concluding thoughts?
I think my last thoughts are really just a gratitude for my teachers, for His Holiness. When I wanted to study Tibetan medicine, we had the wonderful opportunity to have an audience with His Holiness, and he guided my path. He told me where to be studying, how to approach it, and I mean, I feel like you look over history of Tibetan medical history and Tibetan history in general, and these masters that pass on their knowledge to their students. And this is why today we still have these treasures. This is today why we can still benefit so many people. And yet I also feel that we are at a point that we need to really be careful that the possibility to lose this knowledge is also
Yes,
really
absolutely true.
And I think a lot of my classmates sometimes said, why don't you study Western medicine? It's
right.
fitting, right? And so I think to our youth, our Tibetan youth, to really realize their incredible cultural heritage and to continue with, their language studies, continue to preserve culture, Buddhism, medicine, right? All the different knowledge fields that are so precious. And so this hope that we together can pass this on to the next generation, and not only pass it on, help grow it and help it to touch more and more lives, because I think it's precious. And so I feel grateful that my teachers allowed a curly-haired Westerner to be
But remember, this curly-haired Westerner, she had that passion and that zeal to learn. See, that was a fundamental quality that you had in you. And Doctor, I wanted to say that in my amazing circle at the Tibetan Children's Education Foundation, I've just been so fortunate to have the support of hundreds of people who have empathy for Tibet, for Tibetan culture. But just speaking to you, an Inji woman, a Westerner, having mastered Sorig, and now to the point where you are educating other people about it. For me, Karma Tensum, a Tibetan, it's been truly inspirational. So thank you so much, Doctor, for being with us today and for being a voice for Tibet.
Oh, thank you so much, Karma Tenzin. Thank you so much for everyone at the Tibetan Children's Education Foundation, everyone who's made this a reality, and your decades and decades of work and dedication to youth and education and to Tibetan culture. Thank you so much.
Kadinche.